There are times when kids need to be taken away from a bad situation, but they can't get out right away. These are real-life experiences happening to foster children in the state's care.
Yeah, tonight, a Fox 8 investigation uncovers how years of budget cuts and overwhelming caseloads leave Louisiana's most vulnerable population at risk. Kimberly Kurth explains in Kids in Crisis.
Best thing that ever happened to me, without a doubt.
Talking about his daughters brings Kim Carver to tears.
Our youngest daughter was actually remanded into foster care at birth because of drug exposure, prenatal drug exposure, and that began our journey into foster care.
Carver and his wife adopted 3 sisters from out of state. The youngest, though, came through the foster care system, and to eventually adopt her, the Carvers had to become certified foster parents in Louisiana.
We started advocating for her as her foster parents first. And she was placed with us as a 7-month-old, and then we adopted her at the age of 2.
Through that journey, Carver said he realized the system wasn't working well.
It wasn't serving children very well, and that we needed to elevate it. We needed to work to improve the system. And part of the way we did that, one, was becoming foster parents ourselves.
So he became one of the founders of Crossroads NOLA, a faith-based nonprofit that partners with the State Department of Children and Family Services to help recruit, train, screen, and support high-quality foster families.
I kiss the face of my daughters every morning as we take them to school, every night when we put them to bed, and I realized that had we not answered the phone, right, and had we not been willing and open, that these children that we're talking about in the state, I mean, these could easily be my children.
And the partnership between Crossroads NOLA and the state may be more important than ever. That's because DCFS is still reeling from years of budget cuts and staff reductions.
We need somewhere between 700 and 900 more staff just in child welfare. 700 more people. There is no way possible in this fiscal reality that we're going to get those 700 people back.
The department's budget was cut by 3% this year. DCFS Secretary Marquita Garner-Walters says they were lucky because that allowed them not to lay off any staff. But that funding is nowhere close to where it used to be. In 2008, when Governor Bobby Jindal took office, DCFS had a $1.2 billion budget and a staff of 5,000. In a Fox 8 investigation over the summer, we revealed by the time Jindal left office, those numbers had been slashed. The budget was $681 million, and the staff was down to 3,300. Now, the current budget is up to $690 million, with a staff of over 3,400. But remember, Walters says the department still needs as many as 900 workers just in child welfare. But this year's budget will only allow them to fill about 250 open positions.
So you haven't laid anybody off.
Right.
But you still have 245 positions that you need to fill. Are
Absolutely.
These critical positions?
These are more than critical. They are critical plus. I mean, yes, they are critical. They are frontline workers that would do child abuse investigations or direct foster care.
Walter says because the department isn't properly funded or staffed, child abuse investigators face double the normal caseload.
Both of those then contribute to the turnover rate because the people get burned out and overwhelmed so quickly they just can't stay, and they can go do something far less stressful than this work, make more money, and not deal with the caseloads that we're dealing with.
Does that put Louisiana children at risk?
Absolutely, every single day.
As a result, Walter says child abuse and neglect investigations take longer than they should. According to DCFS policy, a case shouldn't be open longer than 60 days. But in New Orleans, that average is 67 days. In Covington, it's 77. And in Baton Rouge, it takes about 82 days to close a case.
Could that larger caseload mean that a child is left in a home where that child may be neglected or in a potentially abusive environment longer?
Yes. Unfortunately, that is what is true. We do prioritize the calls as they come in, so we go to the most critical first. And so do we hope that we're seeing every single child we need to? Of course we do. That's our charge. Are we able to do that with our current structure? No, we're not. We also need cars. We have not bought new cars in this agency since the Blanco administration until about 2 weeks ago. We just put 27 new cars in the field.
Walters says that's especially needed when you consider what happened to a DCFS worker trying to remove a child from a home.
Which is the hardest thing that we do when we have to separate a child from their family. They got in the car and the car wouldn't start. How horrible of a situation that you already have a child who's crying, distressed, acute trauma situation, and the car won't start? That's unforgivable.
Budget cuts have also impacted the recruitment of new foster families. Right now, about 4,500 children are in the state's care. All are placed with foster families, but there's only 2,200 certified foster parents. And DCFS says that leads to households with too many children. In an effort to get the 500 more foster families the state needs, DCFS recently launched a new program called the Quality Parenting Initiative, or QPI. This program aims to recruit new foster parents and ask more of current foster parents.
We're going to ask them to be the ones to make those therapy appointments and doctor's appointments and take another step up even more than they're doing to make sure that every single day every child is getting quality parenting regardless of who's offering it.
And both Walters and Carver say the community must step up to help children in the state's care.
We will never get back to where we were if we are just waiting on the government to do it. So we've got to have stronger, better partnerships.
We need families to step up and say, you know, we're going to be of help. We're going to take care of the most vulnerable in our society, because that's our job. That's our responsibility as human beings.
Through his own personal story, Carver wants those in Louisiana to know just how rewarding being a foster parent can be. He would tell you he and his wife wouldn't change a single thing when it comes to how they built their family.
After I've done it, this would be my plan A every time.
Secretary Walters and her executive team are also going on the road to meet with community partners across the state. Anyone is invited to have a conversation with DCFS leadership about child welfare and poverty. The department also has a new private partnership that will help pay for 9 new state recruiting positions. Those workers will focus on finding foster homes for hard-to-place children. Those are children who are older, disabled, or part of a large sibling group. DCFS also tells us despite their staffing and budget cuts, they had a record number of foster children adopted over the past year. For Fox 8 News, I'm Kimberly Kurth.
My first day in the foster care system was horrid, very horrible.
Zulima Meza fought back tears as she told us her story. Taken from her family, separated from her younger brother, and put in separate foster homes in August of 2014.
I didn't know that would be the last time I'd see my brother for 3 weeks. I want to say last time I'd hear from him. I didn't know what to do. At the time, all I could think of is the place where my brother is suitable for him, or are they going to treat him well?
Feeling helpless about her future.
What is going on with my mother? Why am I here? And I want to say I didn't eat or sleep for 2 weeks.
Meza, 16 at the time, her brother, 15.
We aren't criminals. We didn't choose to be put in a foster care system. We didn't choose to be ripped away from our family. Some of us, our parents just so happened to not have food in the house, or you played too rough and you got bruised, and your parents can't explain what happened to you and it looks bad on them.
Meza says she knows firsthand what years of budget cuts, overwhelming caseloads, and staff reductions mean for children in the state's care. In 2008, when Governor Bobby Jindal took office, the Department of Children and Family Services had a $1.2 billion budget and a staff of 5,000. But a Fox 8 investigation revealed Jindal's administration slashed the budget to $681 million and cut the staff to 3,300 by the time the governor left office.
The people in the system, it shouldn't be just a job. I mean, they do need more people working there, and they need more people in the community willing to participate in helping these kids. Yes, they're in foster care, but soon they'll be out in society, and you want us to be contributing in a positive way. And if you don't have that support, if you even in care, then you're basically setting us up for failure in the end.
When Meza aged out of the system this year at 18 years old,
even with the judges say, you know, make sure this young girl has somewhere to go, it wasn't done. On my 18th birthday, I left court, walked, caught a bus, and got to class, and that night I had to figure out where I was sleeping.
She says she was cut loose with nowhere to go.
I was homeless for 2 weeks, and then someone, a relative of mine, took me in for like a month or two, and then after that I was like in and out of my car. I sleeping on friends' couches, and at some point I slept in a friend's closet. I had a twin bed in a friend's closet.
But before those budget cuts, the state offered the Young Adult Program to help foster kids like Meza. The DCFS secretary said that money came from the state's general fund. Once cut, she said it wasn't coming back.
So what happened was that children aged out and walked away from us and had no state resource with them. That's unforgivable.
Walters says the state needs to do more to make sure kids have what they need once they leave the foster care system. Things like a driver's license, access to food stamps, and Medicaid coverage.
The bottom line is we need to do a whole lot better in making sure that they don't leave here without an adult, without some attachment to a caring, competent adult that's going to be there for them when they have a crisis.
Meza is now getting help from a nonprofit called Project 18.
We founded Project 18 because of the reduction in services that we saw, and so it was a response to what we saw being eliminated from Baton Rouge. As a former foster youth myself, I understand how much support is needed to go from transitioning from care to actually being successful.
The founders of Project 18 say they help with emergency assistance for everything from rent, transportation, to tuition assistance. A family for those who don't have their own.
It's one of the most amazing things I think that we were able to do recently was be there for one of our young people. She went into labor. We got the phone call at like 4-something in the morning, and it was on Halloween, and we were able to be there in the delivery room and see the amazing experience of seeing a baby being born.
As for Meza, she's now reunited with her brother and in her second year at Delgado.
People don't like to think about these things, but what if it was you? What if it was your child? Would you just stand back and let it happen? Would you be silent about it?
She aspires to be a doctor and one day be a voice for kids like her.
I know when I was in care, there was so many times I just wanted to scream out and help me, someone do something. This is not right, I didn't choose this.
DCFS says that voluntary young adult program that was cut in 2013 did provide more state resources for kids who aged out of the foster care system. They were also given a caseworker to help monitor their transition into adulthood. DCFS says they still offer a caseworker to kids once they leave care, but it's through a contract provider, and the state says they're not going to provide the same level of services. DCFS tells us they always try to keep siblings together in foster care unless it's in their best interest to separate them. And we're told they formed a task force to try to prevent homelessness and address the needs of kids aging out of the system. For Fox 8 News, I'm Kimberly Kurth.
The medical director of the NICU at Children's Hospital sees it far too often. Innocent victims of mothers hooked on drugs.
They'll start to show signs of withdrawal. They'll be very irritable, hard to console. They have a lot of difficulty feeding. They can have some breathing difficulties. They can also potentially even have seizures. It can be a life-threatening complication, the withdrawal symptoms.
Despite that disturbing outcome of opioid addiction, Dr. Brian Barkmeyer sees more and more of those newborns.
In the past 10 years, the problem has escalated tremendously, not just in Louisiana, but across the entire country.
When an infant tests positive at birth, doctors like Barkmeyer are required by law to report it to the Department of Children and Family Services. The number of those cases in Louisiana is staggering. In 2008, DCFS says about 570 newborns had drugs or alcohol in their systems. By 2015, that number climbed to more than 1,500. And nearly 1,700 already this year.
Are you alarmed by these numbers?
Very alarmed. Very alarmed.
Denise Evans is the DCFS regional administrator for the New Orleans region. She says the majority of cases in our area involve newborns exposed to prescription drugs, heroin, or marijuana.
Drug-affected newborns often that's not the only thing that's in the home. There could be domestic violence, mental health problems. They're not taking their medication and they're prone to have, psychotic behavior.
Evans says once DCFS is notified that a newborn has been exposed, they must investigate and decide whether that child and any siblings will be safe in their home.
So we look at the entire family. We look at the environment that they are living in on a day-to-day basis. We look at their functioning. We look at the adult functioning. What are these parents doing daily? What's their daily routine? How are they caring for their children?
As you might imagine, Evans says that's not an easy job, especially these days, when you consider DCFS is still reeling from years of budget cuts, staff reductions, and now overwhelming caseloads. A Fox 8 investigation revealed when Governor Bobby Jindal took office, the department had a $1.2 billion budget and a staff of 5,000. But by the time Jindal left office, his administration had cut the DCFS budget to $681 million and the staff to 3,300.
We're doing things quicker. It may not be as comprehensive as we'd like, but if you've got that overwhelming amount and you have limited time, that's going to affect these families, and I get concerned we miss something that's very relevant. Maybe not talk to those we should have because we're rushing.
Evans says that could leave children at risk.
If we're not fully funded, the bottom line is that we're going to be challenged in making sure children are safe. You can only do so much with a little, and it's going to get worse.
And Dr. Barkmeyer says budget cuts can make helping substance-exposed newborns even more complicated.
Because a lot of the moms involved don't always have the good social support systems themselves. And so by law, we're obligated to report these situations to the DCFS, and we rely on their assistance to look into what's necessary to be done for the babies. In some cases, those resources are pretty obvious and readily available, and in some cases, the resources are harder to find.
The doctor we talked to says that problem also comes at a great cost, not only for these babies who face life-threatening illness and developmental problems, but also to our state. He says many of the infants' medical care is paid for through Medicaid, and the cost of hospitalization just for 2 to 3 weeks can approach $100,000 very easily.
This looks like a normal home for a teenager. In it, you'll find bedrooms with twin beds and stuffed animals, and a living room with video games. A closer look, though, you'll see it's anything but.
This home is somewhat isolated geographically in a rural area.
With surveillance cameras keeping an eye on the house and schedules keeping kids on track, this is a Louisiana safe house for sex trafficking victims. This psychologist has helped more than 40 young girls here.
Girls who have a history of sex trafficking suffer from complex post-traumatic stress disorder. That is like post-traumatic stress disorder on steroids. Because these girls are not traumatized 1 or 2 times, they're traumatized every night.
When victims of human trafficking come into the care of the Department of Children and Family Services, some may be referred here, the Free and Deed Home. There, a specialized treatment program awaits with 24/7 supervision, state-approved homeschooling, and perhaps most importantly, therapy.
They have art therapy, they have music therapy, they have equine therapy. We are faith-based. We do not force any resident to attend church or to pray or to do anything, but they certainly are free to do so.
And care like this may be more needed than ever in Louisiana.
I think the growth, if not the explosion of sex trafficking in general, including adolescent sex trafficking, because many of the consumers, many of the Johns as they're called, want young girls. Really can be traced back to the explosion of the internet.
According to the most recent report on human trafficking from DCFS, there are hundreds of victims in Louisiana, nearly 290 trafficked for sexual purposes, and more than 100 of those were children.
I mean, we have human trafficking victims as young, it's been documented as young as 7.
Denise Evans is the DCFS regional administrator. She says at any given time in our area, as many as 5 human trafficking victims are in the state's foster care system.
When there is a big event, if there's a Super Bowl, if there's Mardi Gras, if there's some large big event that bring others from the outside that's very well known, then we actually set up a process where the FBI can contact us if needed regarding a child either being abandoned, not having a caretaker, actually being involved in trafficking.
And Evans agrees these are kids who have been through unimaginable trauma.
I mean, can you imagine that and being sold to other people? Developing trust in anybody would be very, very, very difficult.
Evans says DCFS is currently recruiting specialized foster homes for these children and training workers to deal with that kind of trauma. But with the budget cuts the department has faced over the years, they have to find creative ways to do that.
If your budget's cut 40%, it's just like a family. You've got to decide where the money's going. You know, if you can't have your basic needs met, if we can't meet the basic needs of the children, then we can't move up that ladder.
And Evans says those budget cuts, gutted staff, and overwhelming caseloads can create a barrier when it comes to helping victimized children.
We would be able to have better outcomes if we had what we needed. I know we would, and children would be safer.
When it comes to children in the state's care, Evans and Salcedo agree it's an area that should not and cannot face any more budget cuts.
This is the only therapeutic group home in the entire state of Louisiana for the treatment of adolescent victims of sex trafficking. There's something about this home that makes them want to stay.
Dr. Salcedo says the Free Indeed home has faced its own financial struggles because of money fluctuations at the state level. They've been fortunate to receive outside support, but he says it's difficult to maintain their facility with the kind of costs they incur, especially when it comes to staffing and medical needs for the girls they help. He says nearly 100% of them come in with a sexually transmitted disease and must see an OBGYN. Kimberly Kurth, Fox 8 News.